Bladder cancer. Bladder cancer is a typical kind of malignant growth that starts in the cells of the bladder. The bladder is an empty solid organ in your lower midsection that stores urine. Bladder cancer regularly starts in the cells, urothelial cells, that line within your bladder. Urothelial cells are likewise found in your kidneys and the cylinders, ureters, that interface the kidneys to the bladder. Urothelial malignancy can occur in the kidneys and ureters, as well, yet it's significantly more typical in the bladder. Most bladder tumors are analyzed at a beginning phase, when the malignant growth is exceptionally treatable. In any case, even beginning phase bladder malignant growths can return after fruitful treatment. Consequently, individuals with bladder malignancy commonly need follow-up tests for quite a long time after therapy to search for bladder disease that repeats. Manifestations. Bladder cancer growth signs and indications may include blood in urine, hematuria, which may make pee show up dazzling red or cola-hued. However, in some cases the pee seems ordinary and blood is identified on a lab test. Incessant urine. Excruciating urine. Back pain when to see a specialist. In case that you notice that you have stained urine and are concerned it might contain blood, make a meeting with your primary care physician to get it checked. Likewise, cause a meeting with your primary care physician on the off chance that you have different signs or indications that concern you. Causes. Bladder disease starts when cells in the bladder foster changes, transformations, in their DNA. A cell's DNA contains directions that guide the cell. The progressions advise the cell to duplicate quickly and to continue living when sound cells would bite the dust. The strange cells structure a tumor that can attack and annihilate ordinary body tissue. On schedule, the unusual cells can split away and spread, metastasize, through the body. Sorts of bladder cancer. Various sorts of cells in your bladder can get harmful. The sort of bladder cell where disease starts decides the kind of bladder malignant growth. Specialists utilize this data to figure out which medicines may turn out best for you. Sorts of bladder cancer include urothelial carcinoma. Urothelial carcinoma, recently called momentary cell carcinoma, happens in the phones that line within the bladder. Urothelial cells grow when your bladder is full and agreement when your bladder is vacant. These equivalent cells line within the ureters and the urethra, and malignant growths can frame in those spots also. Urothelial carcinoma is the most widely recognized kind of bladder malignancy in the United States. Squamous cell carcinoma. Squamous cell carcinoma is related with constant bothering of the bladder, for example, from a contamination or from long-haul utilization of a urinary catheter. Squamous cell bladder malignancy is uncommon in the United States. It's more normal in pieces of the existence where a specific parasitic contamination, schistosomiasis, is a typical reason for bladder diseases. Adenocarcinoma. Adenocarcinoma starts in cells that make up bodily fluid-emitting organs in the bladder. Adenocarcinoma of the bladder is uncommon. Some bladder malignancies incorporate more than one kind of cell. Risk factors. Variables that may build bladder cancer hazard include smoking. Smoking cigarettes, stogies or lines may expand the danger of bladder malignant growth by making unsafe synthetics gather in the pee. At the point when you smoke, your body measures the synthetics in the smoke and discharges some of them in your pee. These destructive synthetic substances may harm the covering of your bladder, which can build your danger of malignant growth. Expanding age. Bladder malignancy hazard increments as you age. In spite of the fact that it can happen at whatever stage in life, a great many people determined to have bladder malignancy are more established than 55. Being male. Men are bound to foster bladder disease than ladies are. Openness to specific synthetic substances. Your kidneys assume a critical part in separating hurtful synthetic substances from your circulation system and moving them into your bladder. Along these lines, it's idea that being around sure synthetic substances may expand the danger of bladder malignancy. Synthetic compounds connected to bladder malignancy hazard incorporate arsenic and synthetic compounds utilized in the assembling of colors, elastic, calfskin, materials and paint items. Past malignant growth treatment. Therapy with the counter-malignant growth drug cyclophosphamide builds the danger of bladder disease. Individuals who got radiation therapies focused on the pelvis for a past malignant growth have a higher danger of creating bladder disease. Constant bladder irritation. Persistent or rehashed urinary contaminations or aggravations, cystitis, for example, may occur with long-haul utilization of a urinary catheter, may build the danger of a squamous cell bladder malignant growth. In certain spaces of the world, squamous cell carcinoma is connected to ongoing bladder aggravation brought about by the parasitic disease known as schistosomiasis. Individual or family background of disease. In the event that you've had bladder malignancy, you're bound to get it once more. In the event that one of your close family members, a parent, kin or youngster, has a past filled with bladder malignancy, you may have an expanded danger of the illness, despite the fact that it's uncommon for bladder disease to run in families. A family background of Lynch condition, otherwise called inherited non-polyposis colorectal malignancy, HNPCC, can build the danger of disease in the urinary framework, just as in the colon, uterus, ovaries and different organs. Avoidance. In spite of the fact that there's no ensured approach to forestall bladder malignancy, you can find ways to help lessen your danger. For example, try not to smoke. On the off chance that you don't smoke, don't begin. On the off chance that you smoke, converse with your PCP about an arrangement to help you stop. Care groups, meds and different strategies may help you quit. Take alert around synthetic compounds. On the off chance that you work with synthetic compounds, adhere to all security directions to stay away from openness. Pick an assortment of foods grown from the ground. Pick an eating regimen wealthy in an assortment of beautiful products of the soil. The cell reinforcements in leafy foods may help diminish your danger of malignancy.